Hi everyone, this is about Calcarea Carb. We know the physicals of Calcarea, fat, flare, fabby children. We'll be getting into the mental rubrics, the theme of Calcarea. So Calcarea is the pampered prince. Calcarea Carb can be a single child or a male child born after some daughters or a female child born after some sons. So the upbringing of Calcarea is such that they've been pampered, they've been overprotected, and even as adults they retain that feeling of being important, and we'll see more of that ahead. So the pampered prince, there's capriciousness in Calcarea. Capriciousness is the quality of changing their behavior very suddenly. So if you offer a Calcarea child a toy that they've demanded, as soon as you give it to them they'll throw it away, and now they want something else. So if they demand something and if you give them what they've asked for, they would refuse it and they would want something else. So this is because they themselves don't know what they want. Their needs are met as soon as they ask for it. And this capriciousness is then seen in Calcarea children. Then there's important feels is pompous. So they know that they're important. They've been made to feel their importance all their childhood. Then there's gourmand. Gourmand is someone who's very foodie, someone who enjoys their food. They have a refined taste, a refined palate. They're very specific about how they want their food. There should not be a little too much or little too salt. It should be just right. So gourmand, it can be seen in children as well as in adults. Then there's delusion of wealth. Delusion of wealth can be in terms of financial wealth. It can also be in other areas where Calcarea feels wealthy. So it can be seen even in health. If a Calcarea patient comes to you and they would use terms like the patient would tell you that they're in a perfect state of health. There's nothing wrong. He or she is perfectly healthy, but there's just this little problem that they've come to you for. So they'll feel like they have everything even in health, but there's just this little discomfort that they want help for. So they feel wealthy. There's this delusion of wealth. They have enough. They have abundance of a health, or even if it's in other areas. So delusion of health. Then there's protection, constantly wants mothers. Calcarea children are very close to their mothers. This can be seen even in adulthood, and they're very attached to the mothers. Then there's this pediatric rubric with single remedy as Calcarea, obstinate headstrong children who are inclined to grow fat. So stubborn children who are inclined to grow fat. Calcarea is the single remedy indicated. We've discussed capriciousness and gourmand. Then there's ailments from what makes a Calcarea carb sick. So admonition is reprimands, like being reprimanded, being scolded, is what makes a Calcarea carb sick, or rudeness, or bad news. So all of these things can make a Calcarea sick. Bad news, there are some more rubrics for it. Ailments from bad news. Then there's cruelty, brutality, inhumanity. Cannot like they cannot see all of this. Children cannot see this being done to someone. Then children cannot bear to see this cruelty even in cinema. So there are two rubrics. They cannot see this happening to someone. They cannot even see this in cinema. Then there's anxiety after hearing cruelties. So they get anxious. If you know a child who gets very anxious after seeing this in cinema or after hearing of cruelties, you should think of Calcarea. Then horrible things, sad stories affect her profoundly. Now, even though there are so many rubrics about ailments from bad news, ailments from cruelty, brutality, they cannot see inhumanity, they get anxious when they hear of such things. Then there's also this rubric in Calcarea where they can be cruel and brutal and inhuman themselves. So I've highlighted this, that even though there's ailments from bad news and cruelty, brutality, inhumanity, Calcarea can be someone who has these traits themselves. Then some other negative traits in Calcarea: disobedient children, adulterous, always late, ungrateful, spineless or coward, dishonest, passion for gambling, avarice. Avarice is greedy or someone who wants money very bad. Then they're very concerned about their image in society, how others see them, how they're perceived. And this concern also gives rise to a lot of anxieties in Calcarea. There's social anxiety, there's stage fright, there's fear of going in a crowded place. Why? Because they feel that they're being watched and being judged, and they don't want a bad opinion. So there's delusion that she's being watched. There's concern about social position, fear of a concern, fear of a condition being observed. This is very important in Calcarea. They feel that their condition would be observed by people. I had this patient who had stopped venturing out of his house only because he felt that the physical ailment that he had would be noticed by people if he went out. So they like, it might not necessarily be there in all the cases, but if you see someone who does this, you should think of Calcarea because they have this very strong fear. They don't want themselves being observed. They have fear of opinion of others. There's delusion that people think that she is insane. Now, this delusion has also come to the surface because they feel that they're being observed, they feel that they're being judged. So, this delusion that people now think that she's insane. So, fear of going in a crowd. Even in pediatric cases, it can be seen where children cry when they're in front of where when they're in presence of strangers. So, if a child uh, gets teary eyed in presence of strangers, this is a form of social anxiety where the child is unable to express that he's or she is uncomfortable, but it is expressed in the form of weeping. Then delusion, confusion that people would observe her. There's this delusion that people would observe her confusion. So fear of a condition being observed, delusion that people would observe her confusion, delusion of being watched. So, a lot of concern about how people are perceiving her or him. Then, about disease and health, there's a lot of fear of disease, fear of contagious diseases, fear of impending disease, heart diseases, incurable disease. At the same time, there's indifference to recovery in Calcarea. Now, this might seem surprising, but what this presents itself as is like, you'll see a patient, they'll tell you that they like they if you even if you inform them that the cure would take a certain amount of time, they would drop out in between as soon as they start feeling better themselves because they're not concerned about cure. As soon as they feel comfortable themselves and their feeling of wealth of health has returned, they would drop out because recovery is not their concern. They're indifferent to recovery. Even though there's despair of health, despair of recovery, anxiety about recovery, all of this is there, but at the same time, there's indifference to recovery and aversion to poultices. Poultice is uh, the material that you use for hot fermentation or cold fermentation. So, whatever you use as local applications in a disease, that is what was referred to as poultice. It can also be taken in a metaphoric way as any advice someone gives to them to make them feel better. Like if someone says, do this for your disease or do that, they don't like it, they have an aversion to it. So, indifference to recovery, they it can also present in a way where they're more concerned about how they appear. So if there's a disease like hair fall or they have melasma, they're more concerned about that And if you tell them that they have some other internal disease which is causing them more harm than their hair fall, they would not be much concerned about it. They don't want to get it cured. They want their hair fall addressed first because they're not concerned about recovery. Then there's effeminate. This is when a man has some feminine traits. So they can have a female voice, or they can make gestures which look feminine. If you see that in a patient, you can take this rubric, effeminate. Then there's anxiety in dark, fear of dark, and desire for light. These can be taken as it is in physicals, but they can also be considered in a metaphoric way. Fear of dark is fear of something that they don't know. It can be fear of the disease that they have, because that is what they'll talk about in front of you. So you can take it from there. If they say things like, what is it that has caused this, or why has this happened to them, or what makes it better? If they're asking too many questions about their disease, if you feel that not knowing about the disease is what they're fearing, so fear dark off. A lot of answers when they're seeking. There's desire for light, desire for answers. So these can be taken in a metaphoric reference there as well. And the fear in Calcarea can be seen. Like they would not shy away from expressing that they are afraid. Like a stramonium patient also has fear of dark, but they try to cover it up. They don't try to let the physician see that they're afraid. They try to cover up their fears. But a Calcarea generally shares with you that they're scared. So this is about Calcarea.